Welcome to the ladies edition. We are back with another amazing episode. I am one of your hosts, Shamika, and my co-host is here as well again.
Of course, I'm here every time. Shelly, hi everybody.
So I'm so excited because this guest I have been waiting for. Cosmetic and functional gynecologist Dr. Michael Reed is here and he's going to talk about sexual health. I hope he addresses these dry vaginas and we're going to talk about the cosmetics of it all and just everything that he does because right before we hopped on, we were talking about Shelly has never had a male gynecologist. My
No.
first gynecologist was a man. But anyway, Dr. Reed, welcome.
Thank you so much for
Yay.
having me. I'm excited to be here on your platform, and I look forward to sharing anything and everything that I can. So uh, I look forward to it. Let's rock and roll. You know what I mean?
Well, let's first talk about what exactly is a cosmetic gynecologist, and how did you pick this particular specialty to enter?
All right. So there's two different things there. So let's talk about the first one. What is a cosmetic gynecologist? Number one is just a term. Cosmetic is a term. All cosmetic gynecologists, we're sprinkled across the United States as well as the world. And what a cosmetic gynecologist is a board certified OBGYN. They finished 4 years of medical school, 4 years of residency, and
Mhm.
they've been practicing and they've listened to their patients. And
Mhm.
usually the story that we all tend to hear is, the patient comes to us and they say, I'm having a little bit difficult time with orgasm, or I'm leaking, or I'm having a dry vagina, or is there anything that I
I'm
can do
immature. I'm
to,
sorry.
to
I
is there
wasn't
anything
expecting
I
you
can
to
do to
say it.
improve the look and quality of my sex life?
Mhm.
Mm.
And when you go to your regular OBGYN, they say, well, that's, well,
Oh, that's
half the time, most physicians are unable to have these
Yep.
conversations.
mhm.
And we'll also find that 65% of women don't even want to have the conversation. They want the doctor to bring it up first.
Yeah.
But then
Yeah.
we got to remember doctors are just doctors, right? So a cosmetic gynecologist said, hey, there's an issue going on. And we want women to identify us, be able to identify us that we do something different. And that's where the word cosmetic is slapped up there. So that you go,
Mhm.
cosmetic, just like you guys just did. What
Right.
the
Mhm.
heck is that? And you'll find that we do a number of things. We help with menopausal health, we help with vaginal dryness, we help with chronic debilitating diseases like lichen sclerosis.
Mhm.
We just do a lot of things that help with the sexual well-being of a woman. And
Mhm.
so the term cosmetic gynecologist, to answer your question, long way around, is just a term so that you know that you found a physician who's done extra training and is listening to the real life demands of the modern day woman.
So
Wow.
do you do like hysterectomies, fibroid surgeries, all those things, endometriosis? Do you deal with all that as well?
So I did. I did that in Nebraska. I was in Omaha, Nebraska originally. And there I had a very large practice, 10,000 plus patients. And, I would do robotic hysterectomies,
Wow.
myomectomies, everything you can think of.
Hmm.
And, and then after doing this for, I think it was at that point, 18, almost 20 years, I was like, I ain't liking this for some reason.
Hmm.
Why is
Mhm.
this is what had me up? This is what pushed me through high school. This is what pushed me through college was the ability to be able to care and be a physician. And now I
Hmm.
wasn't liking it. And so I would reach out to other docs and say, have you ever felt this? And, everybody would receive that as a weakness, right?
Hmm.
Because as physicians, we're supposed to be able to handle everything and take care of everybody, but we're people just like everyone else. And so we
Yeah.
had stressors and concerns and those kind of things, and looking for help, and in doing so, I found that I needed to re-educate, find a new passion, and that new passion became cosmetic gynecology.
Hmm. Okay.
Wow. Now, what age range do you normally see your patients? Is it normally younger women or older women who seek out your help?
Well, so I see the whole age range, because we're
Mm.
not just dealing with just cosmetics. So, like I talked about, lichen sclerosis is one. So that's a condition where you can get loss of labial tissue. You can get scarring of the clitoral hood to where you can't uh, achieve pleasure as you would like. And sometimes that affects young women in their early 20s, and they need to be seen. Or I see younger women that are having pain, a pain of the vulva.
Mhm.
Mm.
So I see younger women, then I see postmenopausal women, I see midlife women, I see the gamut of women. I see women, and I take care of them. I see women.
Okay. Well, do you have?
Wow.
I'm still stuck on the clearly the vaginal dryness. I'm circling back to that.
Just go on and ask that
You
question.
want to? You
Let's
want to? You
just
want
go
to
on
know
and
more?
get that question
Yes, I
out the
got to get it
way.
out.
Please do it right now.
It's brewing right here. So,
Hmm.
so you mentioned you had heard some of our previous episodes, and people listening know that both Shelly and I have had hysterectomies after having a long bout with fibroids. And so with those menopausal, perimenopausal, all those changes, there's vaginal dryness.
Yeah.
And I want to know why and how to fix it. I mean, granted, I went to pelvic floor therapy for the leakage.
Hmm.
That helped.
Okay.
And it
Okay.
did help with the dryness. But for others, and being on HRT, but for others that may not have a doctor that is open to talking about it, took me going to a few doctors to actually talk about why. I was like, why is it itchy down here? What is going on? Why is it just so dry? Let me just stop. But can you
I think
speak
you
to
should
that?
keep going, because a lot of people need to hear it, because
Right.
they
Yeah.
I mean,
still feeling it
it was
and they
to the
feel like
point
they're
I could
alone.
not put underwear on. Like
Hmm.
it was
Yeah.
bad.
Yep. Yep.
Wow.
Yeah, it can be quite debilitating. So, what I've heard from you guys is that, you've had a hysterectomy. Did they remove your ovaries? Not remove your ovaries?
We still have our
No.
ovaries.
Yeah.
Okay, exactly what I thought. So they would save your ovaries, but there is studies that show that even though you leave the ovaries in place, you compromise blood flow, because there's a change in blood flow because you removed the organ, right? You removed the uterus.
Oh.
And so the longevity of your ovaries aren't as long as it would ordinarily be. The
Hmm.
average age of menopause in the United States is 51, but after hysterectomy, where you're not removing the ovaries, that can change and fluctuate. And so some of
Yeah.
the earlier signs in the perimenopausal times is we start to see is vaginal dryness. Now,
Mhm.
sometimes this comes from the fact, yes, our estrogen levels are going down, but we're also busy, career oriented women. So we're not drinking, we're not staying hydrated, we're running podcasts, we're doing anything and everything besides
The
running
He
shade,
and being
talking
Doctor.
about
hydrated.
you.
Another thing
You're
that
not
can
lying
also
though.
the other thing is vaginal estradiol. You can apply vaginal estradiol to the vagina. It will not cause
Mm.
breast cancer. You can use it damn near with any cancer.
Mhm.
When I mean
Mm.
that, not just any, but I'm being somewhat facetious. But if you have endometrial cancer and it was less than stage 1A1, you can use vaginal estradiol. If you have breast cancer, you can use vaginal estradiol.
Huh.
Vaginal estradiol can help. It will help keep the vagina moist. I mean, you remember if you've had children, you remember when you were pregnant, vagina was moist. It was like a sponge wet. I mean, it was everywhere. So
I'm
you
so
know
sorry,
that the
Dr. Reed.
vagina
The word
loves
voice
estrogen.
sends us into hysterics because we are.
We're just silly.
Yeah,
That's just it.
we're sorry. I'm sorry. Like
But
I could
why
see her
does
face, and I was like trying not to.
but why does, and I guess this is just
Yeah.
any body part, but this area changes, it seems like so rough, so harsh, like it just changes in color. Yes or no? It
Yeah.
kind of changes in color, it changes in size,
Yes.
it
Smell.
just smell. I mean, are we just doomed? Because when menopause happens, it's like, I'm just going to say it. I don't have my 20-year-old, even 30-year-old vagina no more. It's like, it's a whole new area down there that I have never known. And I want to say it happened when I had my hysterectomy. Everything was fine up until then.
That's,
Yes.
It was fine. Okay. I had it
what
at
I
what,
told you
46.
before is, yes, that change in blood supply. That changed, and so the ovaries, waxing and waning a lot sooner. But I didn't mean to interrupt. That was, I shouldn't have done that. But keep going.
No, but it's kind of driving me crazy because I know we're getting older and things aren't going to stay the same. But I wasn't expecting such a drastic change when we had a hysterectomy. It was I had my hysterectomy first, and then Shamika had hers months later. But it was just like we're both this why we have this podcast, because we had no knowledge of menopause. None of our doctors talked to us about it. Definitely not my gynecologist who did my surgery. She actually told me I wasn't in menopause. So she was like, oh, you're still 40, you're 47, you're not in menopause yet. And I'm like, well, why am I having this weight gain? 20 pounds, 30 pounds in less than a year. Why am I having, Shamika had the dryness. I didn't have that, but I had other things. And I'm like,
Mm-hmm. Mm-hmm.
why didn't anybody tell us this?
Yeah.
Well, thank goodness you have this podcast, and you telling a whole bunch of people this. So,
Yeah.
right?
Right, we are.
And so, I mean, and that's why I just love being a part of it. I'm very passionate about this, really educated about it, and you know, I just love it. So, anything you want to ask, you can ask, and we try to give you the best answer we can give you. Go right ahead, Shamika.
It's not on Shelley's approved list of questions.
What?
So sometimes Shelly and I have had this discussion, and we were talking about the size changes, right? Down
Mm.
below. And I was asking her, does she have one side that's bigger than the other? Because I do, but I also had a cyst there that had to be removed. So
Mm.
do you see, so like for something like that, is that something I would come to you for cosmetic
Yeah,
gynecology for?
you would want to come to me, because if your general OBGYN is not trained on handling really any kind of cosmetic issue regarding your vulva. I mean, we're not
Hmm.
trained in doing that. And
Mhm.
so, yeah, you would want to come, and generally I just try to figure out what it is that you want to accomplish, what is your biggest bother, and then outline how we might go about it. Is what I generally
Okay.
do. Yeah.
Okay.
Now, I did see on your Instagram you were doing you had two chicken pieces of chicken thigh. I
Hmm.
want to say they were
Yeah,
chicken.
yeah.
Now, what exactly were you doing? You were demonstrating what type of surgical procedure? Uh-oh.
Fraps. Fraps.
Oh my. First of all, where do you even get something like this? Look at that thing.
This is a vulva,
My God.
and it comes from the vulva puppets. It's the vulva puppet. And I purchased this at Ishwish. It's called the International Society for the Study of Women's Sexual Health. It's
Wow.
a conference that's held every year for physicians to want to learn more about
Hmm.
caring for women when it comes to sexual health. And so one of the vendors there had all these puppets, and they are, you know, e- as realistic as you can get. I mean, you have
Yeah.
labia majora. I mean, we're just real quick. Everything that my hand is in front of is the vulva. Okay. Then we have labia majora, labia minora. This is the clitoral hood. Underneath the clitoral hood is the clitoris, right? Just below the clitoris is the urethra. This is where you actually urinate from.
Mhm.
This rib portion on the anterior vaginal wall on the inside is the G zone. That's what that represents, the G zone.
Oh.
So everything is there. And so, to answer your question, when we're looking at the vulva this way, this is the way you're looking at it when you're lying on your back. But when you're standing, your vulva is more in this configuration. And sometimes you'll see that this will sag and
Yes,
hang,
that's
and
what it
people
is.
don't like how this sags and hangs. And so, what I was demonstrating is that we do have a procedure called a labia majoroplasty, where we actually make an incision in this crease, remove some of the skin of the labia majora, pull it over so that the scar is in this line, and you actually are tightening up the skin of the vulva so
Oh
that
wow.
it's not dangling anymore. Huh? So that's what I was demonstrating with
Wow.
that we can do that with that procedure. But I
Okay.
want to go back to vaginal dryness because a lot of people are affected with vaginal dryness.
Yeah.
And so we've
Mhm.
talked about one treatment option, and that one treatment option we talked about was vaginal estradiol. And I support vaginal estradiol 100%.
Hmm.
It remodels, it creates collagen, elastin, and a new blood vessel growth. But
Oh,
it's not
wow.
high powered. It's going to take a long time. It will get there. And a lot of times, vaginal estradiol makes sex pleasurable, but it doesn't make it like, oh my gosh, like it was back in the day, right? So there's some different options that you have, and I'm going to share just a few of these. Uh, One is the magic stick, I call it. It's Thermiva. Basically, it heats up the vagina, and that
Oh.
heating process of the vagina stimulates collagen, elastin, and new blood vessel growth, which will lead to more lubrication of the vagina. It will make the vagina more resilient, more dynamic, and sometimes gives you a little bit of snapback, like 10% improvement in tightness. But on top of that, it can help you with urge and stress incontinence, right? Here, check this
Wow.
other one out. This is carboxytherapy. This is CO2 lift called carboxytherapy. A lot of people use this therapy on the face. This one's specifically designed for the vagina. They've changed the pH so that the pH is more consistent with the vagina, and they've also added a mugwort, which helps also with the vagina. And so, what you do is, let me see here. Yeah, is you just are mixing a big packet with one of these little packets, right? And
Okay.
it creates a gel, like a face gel, and
Oh.
you aspirate it into these little tubes here. One tube is one treatment, so you aspirate what you've mixed up. You place that in the lower one third of the vagina, and then you place the rest on the outside of the vagina. So, what is carboxytherapy? Why are we doing all this? Well, as you know, there's a relationship between trees and humans, right? We push out CO2, they make oxygen for us.
Hmm.
So,
Yeah.
when we don't have enough oxygen, we build up CO2. And so that means we need more oxygen, and our body says, hey, this is dire straits. This is an emergency. Something's going on that we have this much CO2 in our body. We need to give that body part a lot of oxygen. And so by
Yeah.
putting that CO2 in that area, stimulates the body to make new blood vessel growth, stimulates collagen, elastin, and in a healing cascade that helps remodel the tissues and helps with vaginal dryness. And it works really well. And you can do it at home without the doctor, without any energy based devices or anything. And it works really well. So, those are like the top three things that I like to offer. There's also laser that can help with vaginal dryness. And all of these modalities work synergistically with vaginal estradiol, meaning it's not one plus one is two, it's one plus one is three. And
Hmm.
so that's a great advantage to these things. That CO2 lift V also works real well for patients that have lichen sclerosis because it helps the tissues heal quicker so that you can begin to do some other treatments to help revive, per se, the vulva. So those are some things that your audience can know about and ask about, and now they know to go ask for a cosmetic gynecologist because
Yeah.
that cosmetic gynecologist has been listening, has the knowledge, and most likely has almost all of these things that I've just discussed with you.
That's interesting. Thank you for sharing that because, like you said, my gynecologist did not say that. She said, I'm going to give you an estradiol patch and send you to pelvic floor therapy, which those that helped. But so I have a I have a random question
Mhm.
since you pulled the puppet out. Um, just because I'm just curious because I feel like I've had this conversation a lot and probably with Shelly too.
Hmm.
We probably talked about this maybe in season 1 about whether or not you should be sugaring and waxing around down there using Nair or any of those things.
Mhm. Yeah, great question. I just wrote an article for Guardian regarding pubes. And it was published in the Guardian just recently. And what you'll find is pews and what to shave and all that. Initially, back long time ago, was a status thing, because you talk about back in the Roman times, only the rich people had bathtubs, hot running water. You know, not running, but hot water,
Yeah.
and so they shaved to make sure they wouldn't get lice. Right.
Mm.
Well, all the poor people weren't able to shave, so they were more they had lice more often than the rich, and so it's more of a class thing back then. Well, things didn't change until Gillette came out with a razor. Gillette came out with a razor designed specifically for women, and then, or actually, first came out for men, and then, sure enough, women were using it. And then about 10 years later, they came out with one, Gillette did again, specifically designed for women, and they went after it. So the long answer is you do as you like. So if you want a little bush, have a bush. If you want to rock an airstrip, rock the airstrip. If you want to be all bare, be all bare. There is really no medical advantage to shaving or not shaving, with one exception, and that's someone who has recurrent UTIs or vaginitis, and they think that there may be some benefit to having hair present in those women that are having those issues.
Okay. Thank you.
Okay. Yeah, because I know my mother would always say, well, you shouldn't use Nair because it's a chemical and you're putting, chemicals on that spot in that area where, obviously things can come from that. Maybe it can cancer causing and all these different things. But I've used Nair for many years and I've often wondered if using that caused my fibroids at some point. But there wasn't enough information about fibroids at the time when I started having them. And my gynecologist didn't really know. She said, oh, well, it comes from stress or, whatever you're eating. And I'm thinking, what am I supposed to be eating that's causing fibroids in large ones? So what is your opinion about fibroids? Because there's a lot of women who have them who don't know they have them until it's too late, and then they have to unfortunately have a hysterectomy because there's no other treatment for it.
Mhm.
Right, right. So fibroids themselves, it's due to just a smooth muscle cell who doesn't obey the typical laws that cells have. One of them is contact inhibition. So when a cell is growing and once they touch each other, they're supposed to back off and give each other space. Well, sometimes they don't, and they grow on top of each other, and you develop what we
Oh.
call a tumor. Now, with
Mhm.
fibroids, they're benign. 80% of women have fibroids, right? 70% are white. Well, 70% of women uh, that are white will have fibroids. 80% of African American women will have
Yeah.
fibroids. African American women, we tend to have bigger, larger, more aggressive ones. We don't really know the reason why. There's some other thoughts that we could talk about, but it's
Mhm.
really an estrogen dependent tumor. So it's
Mhm.
dependent upon estrogen. So if you have cells that aren't obeying the laws, and then you're making estrogen as you would in your reproductive age, then you're kind of feeding that cell, and that cell will grow, and you develop uterine fibroids. But it's
Wow.
very common. Yes.
Mhm.
Okay.
Did I answer your question? You all
Yes,
got
you did.
quiet.
No, we definitely understand. I mean, we've talked about fibroids. I think our entire first season,
Mhm.
because we were so there wasn't a lot of information out there, and our doctors didn't have as much information.
Yeah.
So we sought out like Facebook groups where we can see other women, that can talk about this. So it's good to hear your opinion on what the fibroids are from usually, but I've
Mhm.
never heard him explained that way. So that helped.
Yeah,
Oh,
it
okay.
did.
Well,
It,
good.
it it shined
Yeah,
a whole
I've
new
never heard
light
him.
on it. Yeah.
Yeah. Yeah.
Yeah. What else do you
So
want to know?
so my next question. So, after a hysterectomy and they take Shelly in that cup, I know that's why she's drinking out of it because she's afraid of what I'm about to ask.
Prince.
Prince, number one Prince fan. Go ahead, Shamika.
Okay, so we talked about this on the show before, but I had no idea what a cuff was until Shelly's like, make sure you take care of your cuff. And I was like, they didn't give me no bracelet. What you talking about? Like, I had no clue what she meant.
She thought it was a cufflink or
Uh-huh.
of some sort.
Hmm.
Okay.
But
Yeah.
I just am curious because I had asked when I went for my 8-week checkup, and I
Hmm.
actually, when I just went for my annual exam, I asked this again, but I think at this point, they're just like, get out of here. But
They just ignore you.
I just want to know how much room is still left up in there after they put the cuff in. Like,
Uh,
does it change the whatever? I don't know the medical term, the length.
yes. So, yeah. All right. So I'll answer that. So
Okay.
the uterus is connected to the vagina. So this is cervix, all right? And you got uterus, and then my hand represents the vagina, right?
Okay.
Connected, all right? That's just the way it is, okay? Now, what you have at the back of the vagina is called the pouch of Douglas. All right. Remember that. So now you've had a hysterectomy. Whoop, uterus is gone. The top of the vagina is open. So
Hmm.
we close that, and closing that is what we call the cuff, the vaginal
Mhm.
cuff. Now, this is also where the pouch of Douglas is at too. And that pouch can accommodate, meaning when you become aroused, can lengthen and change. The vagina is dynamic, okay? And it will change. So you can have a patient, not a patient, you can have a lover that is, well
That was
endowed.
that. Okay, that's what I was
Well,
getting
that's
And
where we were going.
right.
I just didn't know
And
how to
so
say it.
when you become aroused, that vagina will relax and it will allow it to accommodate. Now, you don't want to be you don't want an elephant, 8 weeks after
Right.
after a hysterectomy. Then, of course, you want to give it some time to make sure things heal and everything's really knitted together. And that's usually at about 3 months. Everything is knitted together, and you're not going to hurt anything with whatever you use. But long as it's not a blunt object, but if it's a penis or something, you should be okay. Yeah.
Does size really matter? Does size how much can one endure
Yes.
in that area?
That
How
sounds
much?
are you talking about? Now, see, that's a difficult question for me to answer. Um, I don't have a vagina
Okay.
or a vulva.
Well, here's the thing, because people talk about size of a penis, and oh, I needed 8.5 inches, 9 inches. But I mean, how much realistically?
If I were just talking from, anatomically, what I
Yes.
see, looking at the biomechanics of sex and all of those things, and thinking about, God designed this whole process, and
Hmm.
penises run from 2 inches to 12 or whatever, right? And then the average is
Okay.
between 5 and 7. And so, given all of those things, I think it would have to be the girth of the penis would matter more so than the length of the penis, right?
Okay.
And that's why ejaculation, you have room to ejaculate because you could have a short, thick penis, but you still need to get back to that pouch of Douglas so that uterus can get that sperm, right? So you have ejaculation. So I think, and again, I'm coming from the fact that I have a penis, not a vulva. I would think that the thickness of the penis would matter more so than the
More.
length of penis. But some women may like the fact of deep penetration, so then that would depend on that person as well. They might like the extra that comes with the extra.
Okay.
Yeah.
All right. Well, staying in the same vein as this
Uh-huh.
combo, what you mentioned 3 months, everything should be pretty much kind of healed up after a hysterectomy. But I have heard stories where and seen in these Facebook groups where some women are like, you know, my husband or my boyfriend or whatever, neighbor, whatever they sleeping with, they are like, I can't wait for you to heal for 12 weeks. And so some of these women are just like, I saw there were posts where some of them were like, they did it the day after surgery, went ahead and had sex. And then there was an incident where I've heard of someone having sex a couple weeks later, and then maybe a month or so after their cuff was torn.
Yeah, absolutely. That's
So,
why you got
like,
to wait.
yeah,
Yeah, if
can
you
you
don't
hammer
wait.
that home for these? No, I'm just
Yes, if you don't wait. This is what I
pretty
used to
sure.
tell all my ladies. This is what I used to tell all my ladies. We talked about the hysterectomy, removed it. I closed the vagina, right? What's sitting on top of here? Intestine. So if you go ahead
Mm.
and have sex too soon and open that cuff, you can have a little visit with a little intestine coming through your vagina.
Woo.
So I would wait till 12 weeks and then you can enjoy it as often as you'd like, but just give yourself 12 weeks. That's what I usually tell them. But you
Okay,
can't
you
have
hear that,
intestine
Shamika?
come through the
I
vagina.
done gave it over 2 years. I still am scared.
She's still afraid.
I'm still
Bless
scared.
your heart. Bless your heart. Now, I want to, we do have a wide range of women who listen to the show, so all age ranges, but I want to know what your thoughts are. I know my mom always would prepare me for each decade. So she would say, in your 30s, this is what you're going to experience, in your 40s, and so on. And so I'm approaching another milestone soon, another decade. And like, what, you know what? Don't act up in front of company. What advice would you give for those women that are in their 20s and 30s about vaginal care? What to look for if things start to change, maybe sooner to take care of those matters before later? Like, what are some of your opinions about the different decades or the ages that
Right.
we
So
should be more conscious
I
of?
would say, 20s and before having children, it should really be an exploration, I think, and understanding your anatomy, looking at your
Mhm.
anatomy so that you can understand what's changed and not changed
Mm,
after having children. So I would say looking. The
Yeah.
other challenge that I would give is to physicians that may or may not be listening would be to have a handheld mirror available for our patients. Every patient
Mm.
that I see gets a handheld mirror because when you think about it, gynecology is the only place you go to and you just accept what the doctor is telling you.
That's
mm.
true.
Everywhere else, they show you a picture. You break the arm, you got an X-ray, you got
Yeah.
a bad appendix. They show you a CT scan. Well, let's
Yeah.
put a handheld mirror in front of the patient. If they don't have one, and if they don't do it, start asking them to take a picture for you. Everyone has a phone.
Hmm.
Ask them to take a picture because sometimes a picture is worth 1,000 words,
Hmm.
and it can really help the patient understand what they're dealing with, why we're asking them to do it for so long, and X, Y, and Z. And then on top of that, they can check the progress as they go along in the
Okay.
treatment.
Yeah.
So I think that is one thing. Now, having said all that, I forgot what your initial question was.
Well, just like, okay, so women
Oh, I
in their
got it. Okay.
30s.
So we
Yes.
talk about 20s and 30s. Okay.
Yes.
So I think we're talking biopsychosocial. I think in the 40s, it's beginning to look at yourself, and you're looking at yourself. You would be wondering, okay, where am I at? Have I accomplished what I didn't want to accomplish or not accomplish? So from that standpoint, looking at where is it? Is it time to pivot? Can you pivot? Would you like to pivot? From a medical standpoint, again, is beginning to educate yourself again about some of the subtle changes that may begin to come on. Vaginal dryness, change in libido, change in maybe your confidence. Um, um, Being mindful of those things in your 40s. The thing that I really try to encourage women in their 50s is to understand that women have now picked up women's sexual health. It's like been sitting on a shelf somewhere, and
Yeah.
Oh
somebody said,
yeah.
"What is this thing?" They blew on it, and they said, "It says women's sexual
That's,
health." And
hmm.
women are now communicating with each other now,
Hmm.
right? And you have platforms like this, and they're saying, "I had vaginal, I had this," and so I think it's that is what we need to continue to do in our 50s is be educated, be open to these ideas, continue to look for that right provider, continue to look for the things that make you happy, and then also remove the things that are bothering you so that you have more room in your brain to enjoy the things that bring you happiness. So, for example, I mean, I was 47 and big as a house. I had got gastric sleeve, then had skin everywhere. I said, I'm taking the skin off, abdominoplasty, and it was the
Mhm.
greatest thing that I can do. So I think that's what you do in your 50s. And then also
Wow.
60s, 70s, and 80s, you keep having sex and having sex. Because I feel like from the patients that I'm caring for, it seems like you thought you had a lot of sex in your 20s. Wait till you get everything together and you have it, and you have a gladiator that's with you and willing to fight for you and your sexual well being, meaning a
Mhm.
cosmetic gynecologist.
Yeah.
These couples, I shouldn't say women, these couples and are having sex 2 times a day. I mean, I mean, there's no kids anymore. They're
Yeah.
walking around the house. They go deuced. So we got to get us back to that,
Hmm.
right?
Hmm.
And
Yes.
I've done some things to try to help us, but it's not about me. It's about your question, and I think those would be the things that I would kind of discuss. And those are some of the things I try to remind patients as they're seeing me and we're talking about some of these life changing things, because some of these life changing things are exactly that, life
Yeah.
changing things.
Yeah.
And having a gladiator to help you decipher, well, this is a life thing, this is a menopause thing, or this is a medical thing, or I hear you and I'm listening. I don't have the answer, but let me see what I can do. You see, this is the kind of gladiator you need to look for and one you should find, especially in your 40s and 50s or any time in your life, to be honest.
Hmm.
But let me stop. Go ahead.
I appreciate that because that makes me feel better. That makes me
Mhm.
feel better.
Yeah, it
Right.
does. Yeah. So I know we're running out of time, but I did have one more question.
Sure.
I wanted to
Well, how
know
long have we
because
been? We haven't been on that long. I can keep going. I love this stuff. Keep going. Go ahead.
well, so we talked about this in the first season about whether or not do you do surgeries on it's probably not even called the mound, but the mound.
Mm.
Do you know what a mound is, Dr.
Yeah,
Reed?
Yeah,
right
she's
there.
talking about the faux pas, sometimes they call it, but it's your mons pubis. And
Yeah.
it just sits right on top, boop, right there, and it mounds up, and
See?
that's what it's actually called. It's called the mons. It's the mound of the vulva. Yeah.
Oh my God.
Yeah. See?
But is that considered surgery? Like what surgery can fix
So
that?
there's different stages. So if it's an earlier stage, you can fix a lot of times with liposuction.
Mm,
Then if you can't do liposuction, then you do sometimes we'll have to do an incision and then remove some skin, and then it becomes a little bit more complicated. But that would be a surgical, meaning incision and removal, versus liposuction. It kind of depends on what grade. There's usually four of them,
Mhm.
and so depending on that stage and what you're at will dictate what would lead to the best outcome.
Okay. Thank you. I knew there was a mound
well,
surgery.
you see how he said it. He didn't say mound like you do.
I'm from the South.
So a lot on our show we talk about menopause, and
Hmm.
that's obviously the biggest topic now for whatever reason. I know my mom didn't talk much about menopause to me. Shamika can say the same. We've heard bits and pieces from our aunts and moms and stuff like that, but for the most part, I just trying to navigate this has been crazy, the menopause, and we're in surgical menopause, so that's an even, I don't want to say a worse category, but it kind of is, where we don't know when our natural body should it was going to go into menopause. And we've just been thrown all these different symptoms all at once. We've been on everything, progesterone. I mean, I can't. If you looked at my counter right now in my bathroom, it looks literally like I got supplements all over the place. I got progesterone bottles. It's just crazy. And
Hmm.
so, how do you recommend women navigate menopause? What are some of your conversations that you have with women about that?
Yeah, so menopause, right, is individualized. There's some similarities between all women when it comes to menopause, but each and every woman has their own journey. So,
Right.
understanding that, my first question when I take care of my patients are, what is it that you want to accomplish? See, I could think that I could do a whole bunch of things and I could do 90 of them, but if I didn't do the 91st, which was one thing that you wanted to be done,
Mhm.
it doesn't matter. I act
Yeah.
as a guide and understanding what it is that you want to accomplish. So if a woman is coming in saying, I'm having terrible hot flashes, my husband and I, I don't know what's going on there.
Mm.
He's not, coming on to me anymore. I'm kind of glad because it's hurting every time we have sex, but I don't feel like we're close. He's telling
Yeah.
me he wants to have sex with me, but I don't really want it. What do I do? So then I hear a number of things there. I hear vaginal dryness, I hear a decrease in libido, and I hear hot flashes. And I hear a loss of intimacy between that patient and her husband. So then it becomes okay, how do we go about it? So we want to, number one, I would be okay, from a social standpoint, you and your husband are happy. You guys need to, number one, uh, I try to at the end, this is more towards the end, but I want them to understand that what's going on is a physiologic thing and that
Yeah.
there is an answer and that there is a treatment and that this kind of sometimes when we think that there's a problem between she and he, really there isn't. They just aren't communicating and don't know that there's a treatment. And they think something else is going on, and really it isn't because nobody's talking about it. But thanks to you guys, they are talking about it, right?
Mhm.
And
Yeah.
so with that, I then go into estrogen. You want to have on estrogen. And the biggest thing, hurdle with estrogen is people are still afraid that estrogen
Yeah.
causes breast cancer.
Yeah.
Hmm.
And over again, estrogen doesn't cause breast cancer. I would say that one more time that estrogen doesn't cause breast cancer. So I would make sure they understand that.
Yeah.
Yeah.
Then if you have a uterus, you should be on progesterone. And that's to protect your uterus from developing a cancer or precancer from being on the estrogen that's helping you with a number of things. And so this comes now to the next part, which is education. And that would be okay. I want you to take estrogen. Why would I suggest you take estrogen? Because one, it can help with your hair, it can help with your skin, it helps prevent macular degeneration, age related macular degeneration of the eyes. It can help with bone health. It helps with your cholesterol. It helps protect the heart. It helps your vagina, your bones. So that's the reason I would like you on estrogen, and it doesn't cause breast cancer. And they go, shit, I had never heard that before. And I
Yeah.
said, good. Okay, now let's talk about the progesterone. We talked about why we want you on it because it protects you. But one of the other things that happens is sometimes as we age, because even myself, I wake up at 3:30 every morning, whether I want to or not.
Same.
Yeah.
And that happens. But,
Yeah.
one of the difficult things is falling to sleep. And we know that
Yes.
giving progesterone will help fall asleep.
Yeah.
And then the next thing, after you get those things in place, then it's making sure they understand vaginal estradiol is also needed in conjunction with HRT, because if you're doing patch, a
Mm.
pill, it will not reach the vagina. There's other modalities
Oh.
to get it. You can get it via a pellet where they put like a pellet in your back or your skin, and that estrogen and testosterone will reach the vagina, and you wouldn't have to do vaginal estradiol. But that's a whole nother topic. But
Yeah.
so then we make sure they have vaginal estradiol. And then lastly is improving their libido. And we do that by prescribing testosterone. So really, you don't need a whole bunch. You do need a few things. But the biggest thing you need is understanding and education as to why you're doing this plus this plus this. And also having a relationship where you feel like you can ask the doctor, now, wait a minute, why you got me on this again? And
Yeah.
every year you just come back. Now, has anything changed? Should I still be on it? And you have that conversation. And that's kind of how I do things. Yeah.
So
Yeah.
the testosterone, so like I'm on the gel. Then you just,
Yeah.
I swear, it made me feel like I had turned into the Hulk after
Yeah.
just like the first couple doses. Now I might be exaggerating and maybe being
Hmm.
dramatic, but
Hmm.
um, how will that gel help?
Yeah. So I can tell, since you're on a gel and not a compounded cream, you have a savvy OBGYN that's caring for you, needs a
Mhm.
little bit more of a push to compound that testosterone for you, because it
Okay.
sounds
Mhm.
like she's telling you to get the testin pack, take this, squeeze it out, make it last a week,
Yep, that's it.
and see if that'll go. Well, that
I wasn't absorbing it last time, and then
yeah,
she just
yeah.
gave it back to me.
Yep. So what I generally do is compound it and
Okay.
get your testosterone level, your free and your bioavailable level. Look at those, understand what your activity is like. Are you a exerciser, go getter? Or are you more just, everyday type of gal? Then we adjust your testosterone dose based on that. And then you know that you're getting the same amount every single day versus they're telling you, well, take a FDA approved
Hmm.
and make a pack last a month. How accurate is that? And so
Okay.
one day you're getting a 10 milligram dose, the next day you're getting a 2 milligram dose.
Hmm.
And so one day you're like, ooh, and the next day you're like,
Right.
is this working? Why,
One day
so
she called me and her voice was deep. I said, "Hello, who's this? I'm playing on my phone. Like, who is
I
this?"
was like,
Okay,
hello.
that's probably what happened.
yeah.
Shamika, now you see. Well, here's
Right.
and then the thing is, we're both on progesterone,
Uh-huh.
but we don't have a uterus. So
So
should we be?
you don't have to be. I
Okay.
would imagine that the reason they're doing it is that you've said somewhere along the lines, I can't fall asleep like I
Yeah,
used to.
me.
And so they say, well, one of the nifty side effects is somnolence. It'll help you
Okay.
fall asleep. And they've done studies that have looked specifically at that. And what they have found is it doesn't increase the duration of deep sleep. So that's why, because you take it, you're not sleeping past that 3:30 or
Yep.
4:30 or 2:30. But what
Hmm.
you should be noticing is that when you're ready to go to sleep, you are falling asleep.
Yeah.
Right.
Oh, see, I will fight it like a little kid and be like, no, I gotta finish typing this one thing. And then that moment passes, and then I'm sitting up here like, now what?
Yeah.
Dr. Reed, this has been such an amazing conversation. Like, you have to come back because I would love for us to be able to get some questions from our audience to ask you
Oh,
as
that
Yes.
would be
well.
great.
Like,
Yeah,
I
yeah.
think they would enjoy this. But how can people get in touch with you? And can people from other states, like where we live, reach out to you for your services and consultation?
Yeah, absolutely. I have patients all across the United States that I care for. We do it via Zoom. I mean, all over. I even have one in Prague and one in Canada, and we do
Wow.
the same thing. And we talk and we order the labs, blah blah. We work it out. And so I'm located in Davis, Davis, California. Uh, Easily I'm called the Cosmetic GYN, right? We talk about
Mhm.
cosmetic gynecology. Well, I'm the cosmetic GYN, and
Okay.
you can find that. That's my website.
Mhm.
That's my Instagram handle. So everything is connected that way. I have a YouTube channel, so if you want to see some surgeries, you could watch YouTube. I've been on a number of podcasts just as nice as this one, and if you want to learn more, there's other ones out there.
You're coming on
Um,
blackdoctor.org soon. Hint, hint,
Yep,
celebration.
yep, yep, yep.
July 3rd.
So we're trying to educate people and let people know that we're out there. And when I say we, we're talking about cosmetic gynecologists, you
Yeah.
know, and we want to move the mark for women when it comes to women's sexual health. Because, like I showed you before, they're just now picking it up
Yeah.
and dusting it off.
Yeah.
And I think with today's platforms and the vulnerability that women are now having and being able to share this even on open platforms as well as with each other, that this has to be addressed at some point. And
Yes.
I like to consider myself part of that movement and hope that women will allow me to be a part of that movement, and help push it forward, because it would be something I definitely want to be a part of. And I just hope that women will accept me with open arms and allow me to be as passionate as I want to be. Uh, and so I am really pleased to be here and be able to showcase a little bit of what I know, at the same time educating and getting us to that point that I so desire us all to be at, because I mean, I was there too, and everything was there for me. That's the
Mhm.
biggest thing. Everything was there. I went through these things you're talking about, and I could get testosterone, I could get surgery, and nobody looked at me crazy.
Yeah.
And
Yeah.
then when I was feeling good, I'm taking care of OBG. I'm an OBGYN. I'm caring for women. I haven't asked not one of them, how you feeling? And
Yeah.
that was another thing that just made me say, well, damn it, I'm not doing right. I got
Yeah.
to do better than this. And so that's what led me down the path to get into cosmetic gynecology, part of it. And then anything that I do, I jump in 2 feet and I go hard. I mean, really hard. I get committed. And so now I'm at a place that I can give what I receive, and I do it well. And I'm so pleasurable, so happy to be here, and I thank you.
And thank you
Well,
for
we
putting
thank
up
you
with our
so much.
foolishness. Well,
With
mine anyway.
Shamika's foolishness. Thank you. Dr. Reed, we do appreciate you. We will definitely be in touch. But for all of our listeners, please go visit Dr. Michael Reed's website. We will link it in our podcast description for this episode. And we just thank you for coming on. Thank you for answering our questions.
Thank you
It
so
has
much.
been very helpful, and your puppets have been as well. So
Yeah.
thank you. I never seen my vulva
There
like
you
that.
go. You got it.
Okay, so now I know it's hooded and all. Okay, all
That's
that
right.
stuff. Okay, thank you so much. All right, so
Right.
Shamika, we're going to head on out, but thank you, Dr. Reed, and we will tune in next time, right, Shamika?
Yes, and you know where to find us online because I never do, but you know where to find us. Just type in
on
Ladies
all our
Edition
social
podcast.
on all our social media, Ladies Edition podcast, Facebook's, what are we? Facebook, Twitter,
Facebook
and YouTube, and
and
Instagram,
TikTok. And
and
TikTok.
Right.
TikTok.
Yes.
Yes.
Wonderful.
All right, you guys. See ya.
Cheers.
See
Cheers.
ya.